Hello again, welcome to Psychology 101, General Psychology, and today we're going to briefly be talking about psychological disorders. So what is a psychological disorder? Well, it's a syndrome marked by a clinically significant disturbance. It can be in multiple different aspects of behavior, of thinking, of emotion, and it often coincides with some kind of deviant behavior, being distressed, or having some kind of dysfunction in one's life. It's important to understand psychological disorders because it happens quite frequently. We'll talk about a lot of the different disorders that exist, and probably many of you can identify a case of this that's either happened to you or someone you know. Historically, psychological disorders have been misunderstood as kind of strange forces that exist, but especially within the last few decades, we've approached psychological disorders within psychology using a more medically relevant model, using diagnosing and treatments. Within clinical psychology and counseling psychology, we use what's known as the DSM. This is the Diagnostic and Statistical Manual to identify and diagnose specific psychological disorders that an individual might have. So let's start with the disorders. So first, we have anxiety disorders. These often involve dysfunctional behaviors that attempt to reduce any anxiety a person experiences. And these occur more often when an individual is experiencing distressing emotions or persistent anxiety. There are many different anxiety disorders, such as generalized anxiety disorder, panic disorder, specific phobias that a person might have about objects in the environment. Obsessive compulsive disorder is another example of an anxiety disorder where people obsess or worry over certain things and then have a strong urge or compulsion to perform specific behaviors. And we also have post-traumatic stress disorder. It often occurs after a person experiences an extreme trauma that leaves them kind of stressed out and anxious over their life situation after that. We also have mood disorders. Again, familiar with a lot of these mood disorders. This is kind of a vague and diffuse feeling state of oftentimes negativity, sometimes extreme positivity. Mood disorders include major depressive disorder. So this isn't just feeling depressed like you might on a day. This is kind of extreme feelings and persistent feelings of depression that leaves some kind of dysfunction in your life as a result. Bipolar disorder is another example of a mood disorder. Having extreme feelings of sadness and extreme feelings of happiness or positivity, kind of moving and shifting in between those. Seasonal affective disorder is another example. This would be having feelings of depression or severe depression as a result of the seasons changing, so feeling sadder in the winter and happier during the summer. And many of these disorders can lead to pretty negative behaviors, such as self-harming, such as hurting yourself, or even suicide. There are many different explanations of mood disorders. There can be biological, social cognitive explanations, but many of these focus on, oddly enough, the fact that some of these can be adaptive in situations, but some of these can also lead to kind of a vicious cycle where, especially with depression, the negative feelings that you experience lead you to understand and perceive other objects in a negative valence, and that kind of reinforces the negative feelings that you have. Schizophrenia is another example of a psychological disorder that's oftentimes misunderstood. It's not having multiple personalities. Schizophrenia is characterized by having delusions, hallucinations, disorganized speech, and having diminished or inappropriate emotional expression. Rather than having two split persons, it's being split from reality, having irrational ideas and distorted perceptions of the world. There can be some problematic behaviors that arise, and there can also be the reduction in very healthy behaviors that people typically perform. Schizophrenia typically develops in late adolescence and early adulthood. It can be chronic or it can be acute, so it can kind of occur spontaneously and disappear, or it can be long-lasting. And there are some biological, genetic, and social psychological risk factors for the disease. So what about some other disorders? Dissociative identity disorder is probably what most of you know as multiple personality disorder, what some people might think is schizophrenia. This is when an individual might have distinct personalities that aren't present at the same time, but the person might be aware, each personality might be aware of one another. And another category of disorders are eating disorders. This can sometimes involve eating a lot of food, it can involve eating no food at all, it can involve binging and purging, it can involve trying to keep weight down in other ways, shape, or forms. It's often caused by skewed or unrealistic body image that a person might have of what they should be or what they currently are. And sometimes it can coincide with not being able to control the amount of food that you eat or your own body. The different types of eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder, and each have their own characteristics of behaviors and kind of self-concept or ideas of how the person looks and feels and behaves. And importantly, these eating disorders each have their own risk factors, each have certain situations or environments that can encourage these specific behaviors. So that's all we have for today. Thank you for your time and attention, and I will see you all next time. Bye-bye.